Okay, so what I want you to do is that I want you to read this with your blind eye. Remember, you have the right eye was blind, so cover your left eye.
Cover my left eye.
And see if you can read or see any of the signs from beginning. You see that there are two alphabets here.
There are two things there.
Okay, that's good, because the
Yeah.
first day you couldn't even see the first line, which was the E. Now you can see the first line and you can see that there are two elements in the second line.
Okay.
Okay, now cover your right eye and see with your left eye. Okay?
Yes.
Now I want you to step back, because the first day that you came, you went up until the 7th line from here. Now I want to see if you still can read the 7th line.
Felopzd.
That's pretty good. Now let's go
Yes.
to the 8th line.
8th line. Defpotec.
Okay, now let's go to the 9th line.
9th line. Lefodpct.
Good. Now let's go to the 10th line.
FD PLTCEO.
Okay, now let's go to the last line.
Okay. PE. No, wait a minute.
Try the next one.
P E looks like an E, an O, an L, a C, F, T, D.
That's great. So you go all the way from 7th line to the 11th line. That's how much you have improved from 2025 to 2010. Now let's interpret that to the real eye exam for somebody who doesn't have any eye problem. Now in your case, you suffer from severe macular degeneration that is usually irreversible. Now so far, in the left eye it has reversed. In the right eye also has improved. Now let's go back. Now you are almost at the standard distance. Now I want you to continue reading. Let's see if you can read the 4th line.
Okay. That looks like a D.
Good.
Well,
What about this one?
EP.
EP, good.
L.
Good, good, good. So you read the 2050. Now let's go to 2040. What is this one?
That looks like an F. E. C. P.
Okay.
And I don't know. What
Okay,
is
so
it?
you read
C?
3. So you read 3 out of 2040. So that means that your left eye vision is 2040 now. So that tells me that your left eye pretty much has completely responded to the treatment, and your right eye that was blind is slightly better. So I think we can taper down your treatments to once a week and then twice a month, because you've reached maximum response to the IV therapies and the oxygen. Stroke basically is something that you need to be concerned about, because the treatments that you receive also lowers the risk of stroke. So you need to continue doing that, because otherwise the stroke will hit you again. So we're dealing with stroke and we're dealing with macular degeneration, and both of them are preventable and treatable. Versus if you go to the conventional doctor and you ask about stroke or macular degeneration, they tell you that there is no treatment for it. You got it, you have it for the rest of your life, you can suffer from residuals. Okay? Versus with the treatments, these are preventable and treatable, but you just have to use what is non-toxic natural therapies.